At least 100 people gathered outside the Kensington Market's supervised drug consumption site today, all part of a rally calling for it to stay open in the face of new provincial rules that would shut it and others down. CTV's John Woodward has the story.
We save lives!
For the crowd gathered outside the Kensington Market overdose prevention site, the issue is deadly serious.
This year alone, we reversed 50 overdoses and saved 50 lives this year.
Some of those people sharing their stories on the microphone.
I feel very safe and grateful for the OPS rooms.
The service has a room where addicts can consume often toxic drugs, and if a user has an overdose, staff are on hand to revive them. In the wake of a shooting outside an East End supervised consumption site last year that killed a mom of 3, the provincial government proposed new rules that they can't be within 200 meters of a school or daycare. The daycare that's too close here is run by the same service. This site is one of 5 supervised consumption sites in Toronto slated to be shut down by the provincial government that would replace them with treatment centres. The new rules will also affect at least 2 sites within homeless shelters. The sites in red are the ones that will no longer operate in Toronto. In a statement, a health ministry spokesperson said communities, parents and families across Ontario have made it clear that the presence of drug consumption sites near schools and daycares is leading to serious safety problems. We agree. That's why our government is taking action to keep communities safe while supporting the recovery of those struggling with opioid addiction.
A terrible idea. It means more people will die.
How many? Not clear, but a CTV News review of federal data showed sites facing shutdown in Toronto reversed at least 3 overdoses a day. Across Ontario, it was almost 6 a day. And Toronto Police neighborhood level data didn't show an increase in crime after the sites were brought in. Those who work with addicts say supervised consumption sites keep people alive long enough to access treatment.
I've seen how people have changed their lives overall, like they've been able to have a family, a stable job.
A service these people say doesn't just save lives, it can change them. John Woodward, CTV News.